Welcome to the Inspired Podcast. I'm your host, Andrea De La Cerda, and each week I'm bringing you the latest discussions and news about changes in the landscape of education and entrepreneurship. As a 22-year entrepreneur, corporate executive, business coach, and leader, I mentor a community of change-making men and women to get out of their box and step into their true calling to make the biggest impact. This podcast is all about empowering us, navigating life's twists and turns, and stepping into the fullest version of who we're meant to be. Today's conversation is a deep one. We're talking about healing, growth, and what it really means to expand our awareness. I'm joined today by Dr. Eva Altobelli, an expert in integrative psychiatry and transformative therapies. In this episode, we dive into psychedelic therapy, what it is, what it isn't, and how it can support both personal and professional growth. Whether you're a leader, an entrepreneur, or simply someone who wants to live with more clarity and alignment, this is a conversation you'll definitely want to hear. Dr. Altobelli also leads retreats and professional training focused on the evolving fields of integrative psychiatry, whether in clinical, institutional, or consulting roles. She remains committed to expanding access to transformative therapies, empowering clients through psychoeducation, and honoring each person's unique path to healing and wholeness. And I am extremely excited to introduce Dr. Eva Altobelli to our show today. Eva, so glad to have you. Thank you so much for agreeing to come on. I think you're just going to bring a wealth of information to our audience, which we really need. So welcome to the show.
Thank you so much for inviting me. And I hope I live up to the bio reading. It sounds daunting.
Amazing. So let's start by talking about, psychedelic therapy. I think in people's minds, we might, some of those who are not super experienced or informed about the topic might kind of hang on that psychedelic, word. What are some of the misconceptions about psychedelic therapy, and can you clear some of those up for us today?
Sure. Psychedelic, I think, came from, psychedelic actually means mind manifesting. So psychedelic therapies and psychedelic experiences speak to things that are altered states of consciousness. Sometimes psychedelic therapies are oriented towards a particular diagnosis, major depressive disorder, complex PTSD, and you could really be engaged in a therapeutic procedure. There's also psychedelic therapeutic experiences that are personal and spiritual growth oriented, that can be done individually or with groups. And there's psychedelic therapies that are more ceremonial. So the bucket that they all fit in is altered states of consciousness, but it's specific to the set and the setting to get more specific about what we're exploring.
So if an individual is not sure this applies to them, or is maybe questioning, I don't know if this is something for me, you mentioned, someone who might have a diagnosis. So let's just say that maybe somebody who's listening doesn't have a formal diagnosis necessarily.
Mm-hmm.
Maybe they're a woman business leader. Maybe they are an entrepreneur. Can this support them? Can this help them? Or is this really saved for those who maybe have more serious mental health diagnoses?
I actually think it's wonderful for personal and spiritual growth. It's really, if you think mind expansion, it allows you to think larger than like we kind of normally live in like a 45-degree angle. So it really opens up to the perspective to 180 or even 360, allowing us to see more opportunities and seeing things both personally and professionally from different angles. Zoomed in, zoomed out. So you have a grander opportunity to see and therefore respond to what you want to do. I think it's really good for growth.
Mm-hmm. I mean, I think, when you put it that way, I can think of so many examples of times when I've reacted to something's happened, which maybe I presume is happening to me. I react from my monkey brain, from I'm just going to come at you, right? Without much context to the situation. Maybe I can do that without stopping and checking about the whole, like seeing the full picture, I guess, which I think is
Yeah.
maybe where you're going with that. Like if we all had the ability to step back and see the full picture of something before we respond, how many conflicts would be eliminated? Right.
Avoided. And so not only is it that, that's more on like a micro level, like it allows us to respond as opposed to react. But even in the bigger picture, it allows you to make decisions about your life based on, reevaluating a sense of identity or your value system or, you know, the the sources of information that we were given by parents and society and culture, and then what feels really in alignment to us that doesn't speak to that we had to kind of shut off, but now can present itself, and we could lean into that a little bit more, like discover self-alignment. And that can be a really beautiful thing that comes out of psychedelic work if done in a really safe and supportive environment.
Right. And we'll get into kind of some of those ethical considerations when it comes
Yes.
to this type of therapy because that's super, super important to this conversation. Do you find that many of your clients come to you with, you know, big dreams or aspirations for their life? Do they see this as a way of getting there? Do they see it as a way of managing their mental health? Like what is generally kind of their situation when they come to you? What's a typical client?
More often than not, it's individuals that are stuck on something, like blocked. Like this, I feel stuck
Can
in
you
this
give me an
process.
example of like where somebody might feel stuck in case they're listening and want to know, do I feel stuck?
Sure. Yeah. Like I'm in this relationship and I'm not sure it's the right one for me. Like some part of me knows it isn't. And I I have this boss and I have this vision of starting something bigger or doing something, but we have fear-based limiting belief systems that prevent us from stepping out. And a lot of our decisions are unconsciously driven by fear.
I mean, I went through a few years, if I'm being honest. This was like around the time that I launched my latest business, and I have a number of businesses. It was about a year and a half ago, 2 years ago, maybe. And I went through a period of time for about 3 years where I felt like I'm putting my head down. I'm working and working and working. Like I'm hustling. And there was this thought at one point in my life where it was like, if I put my head down and I work really, really hard, at some point I'm going to pull my head up and people are going to notice. And then that didn't happen. It's like I
Mhm.
worked and worked and worked to the point where close to burnout. Actually, if I'm being honest, it was burnout, full burnout, right? And
Mhm.
still I'm like,
Yeah.
wait, but there were no fruits of that labor. Or wait, what happened? Where I just felt
Mhm.
like, okay, there needs to be some sort of paradigm shift, I think, in my life because this isn't working for me anymore. I wonder if that's a more or less, if that's a common, rut that women, especially ambitious women, get ourselves into of like, we don't need the limelight on us necessarily. That's not what we're going for, but we're just going to like do our thing. We're going to, we're going to commit. We're going to be all in. We're going to support someone else and hope that one day we get rewarded for it. Would that be an example?
Yeah, and that's also, it sounds like a bit of an isolative journey.
Oh yeah, no doubt.
Like I was reflecting when you were talking on that phase in my life, and I had the same experience, and I was like in it and alone and burnt out. And it wasn't until I was able to be more vulnerable and more honest and ask for supervision and mentorship and share my burdens that I was able to see different perspectives and let go of some of the sort of the need to control something, because that's not sustainable or realistic.
If you're listening right now and you have a need to control on the daily, just be mindful. This might not be sustainable. Oh my gosh, it's so true. And also so
Mhm,
common. I mean, I think that and also as women, we are so stretched. I mean, with so many different
mhm.
responsibilities, not just the responsibilities that we think are I think that we add responsibilities to our plate that weren't even there to begin with sometimes when we feel a need to take care of people and manage the home in the way that we want. I mean, we put things I think sometimes others do on us, and then we do it too.
Hmm. Yeah. Like, I think for me, it was a bit of a defense mechanism not to like really feel all the things.
Mm,
And in avoidance of feeling, I would do.
yes. Oh,
So there
yeah.
was like a take action. I can do something about this. And that sort of became a waterfall that was never ending.
Right.
And that was really not
Totally.
productive
And then they come
for
to
me
you
personally. It
and they
was,
have got these habits
mhm.
of just doing, doing, doing. And now they're forced to feel, I imagine. Like, what does that experience feel like for a woman who's just been like taking it all on? Obviously, I'm realizing this isn't working for me. I'm
Mhm.
stuck in my life, or I'm not sure if my marriage is going to make it, or I don't know if I can do this work anymore. Like, what are kind of some of those pain points that they feel when they come to you?
Do you know what? It's interesting. At that point, I read a book. God, I can't remember what it is. If it comes to me, I'll bring it up. But like, we teach people how to treat us by showing up in the way we do. Like, if they ask us to, can you just pick that up and we do it, then they'll keep asking us to do more and more and more. And so, like, we are complicit in how people treat us and put expectations on us, as well as how we show up. So I think the pain point isn't very gentle. It's hot. It's overwhelm and agitation and not feeling like you have space or time, feeling that self care is a luxury as opposed to a responsibility and a necessary part of your physical health.
Do you see that more with women than men? Or do you see that across the board?
Yeah,
You do.
definitely more with women than men for sure.
There is something that we learn about that. Like, what the heck is that about?
Hmm.
That somehow, like,
Right?
mental health or self care is somehow, I'm being selfish by taking this moment for myself, or this is a waste of money if it's for me and not for someone else that I care for. How do you see that?
It's indulgent to just like, I need to just go take a walk at the beach. Like, it doesn't even have to be specific to going to therapy, but just like going to the gym,
Or it doesn't even have to cost
meditating.
money, you know? But sometimes
Yeah.
the idea that I'm going to be away from my children for a couple of hours, or I remember when
Yeah.
my gosh, I remember when my kids were like infants, and it was like the sleepless nights and then breastfeeding all the time. And I'd have like a couple hours of a window. I remember going to the grocery store and like hiding in the magazine section back in the day when there was a magazine section, right? Like an extensive, and I would just sit there and I would just read magazines. It was like, and I would feel so bad about it. And then I'd come home and I'd have to figure out this reason why I ended up at the grocery store for so long. It was like I had to like come up with this reason. Oh, I tried to find this ingredient. They didn't have it. They had to go to the back room. Like, I don't know. I had to come up with a whole story.
Me too. I kind of did the same thing. Like, if I came home, my like guilty pleasure for disassociation is dumb TV. So if I came home and was just watching dumb TV and then like somebody would come home, I would like turn it off and get up. So like make it look like I was busy or doing something. Or even the like, did you just wake up? And it's like, no. Like, men are more inclined to be okay with indulging their needs.
Right. But it's not as socially acceptable for us to do it. And I do also
No, it's
remember
not.
when I was married with, again, small infants. I remember the time, again, back to the grocery
Hmm.
store, something about the grocery store that was like my escape. But there were times when I would go with my husband and my infant, and I would be enamored by the magazines when we were in line, right? So I'd be like, ooh, like, I'd be like Jennifer Aniston, Angelina Jolie. Oh, that's an interesting like love triangle. Like I was like all about it. And then my husband at the time was annoyed that I wasn't doing my job of putting all the food on the conveyor belt. And I was just I was like I was just So then it ended up being an issue later in therapy. He's like, remember that time you
Yes.
went to the grocery, you didn't even put the food, I had to do it for you. And I was like, I was just reading the cover of People magazine, like I couldn't help it.
And why is it your job?
But yeah, there are these kind of
Yeah.
also unspoken expectations on us that we
Hmm.
are sometimes aware of and sometimes maybe not even aware of, that that send these messages that that's not okay for you to take that moment for yourself.
More often than not, I feel like they're so subtle I don't notice them. And I didn't notice it as much until I shifted from the like private practice to like owning a whole business. And then when I'm at places where other people in my position are all men and we're engaging in a conversation, like none of them say, I'm sorry. Just as a matter of course, like, oh, I sat, I pulled the chair, whatever. Like women just apologize. We are more inclined to acquiesce and not speak with power and conviction and confidence when we know the right answer. Whilst men were speaking with more confidence, whilst I was clear that, like, I know more about this than you, but they have like a natural assumption of ownership of information and power and air and bandwidth.
Mhm.
That is something we don't take up as much
Yeah.
space in that and feel, or at least I feel a little apologetic about taking up ownership of knowledge and power and
Yeah.
space in business world.
It's so true. We do struggle to take up space. That's one of the things my business coach is always like, Andrea, take up more space in your life. Like it is like a mantra. Like I even have it on my
Yeah.
whiteboard. Take up more space in your life. So let's talk a little bit about the therapies that you do, because I'd love to in that setting, how can something like the services you provide be transformational in a woman in the way that she sees herself and the way she shows up in the world? Does it work that way? How does that work?
I tend to feel that a lot of it is unconscious belief systems. Our or even if they're not unconscious, they're like just automatic. And so to work with people to slow down and gain an understanding, which is one of the nice things that actually ketamine is good for some reason, it just like if time normally works at a particular speed, it just dials the knob back so that a little bit we're in slow motion so we can see how life happens and how we experience it and how we normally react to
Mm.
it. And then we get to be like, oh, I do that. And gosh, it would be nice. And me doing that creates a cascade of other events to happen in my life. And if I do respond to this differently, I will have different opportunities as a result. So creating some clarity about how we're showing up and what we're doing, and then holding on to that even after the deeper
Wow.
sessions.
Almost like, I mean, the way you explain that in my mind, I'm like imagining almost that you can kind of look at it in slow motion, or maybe look at it as if you're watching kind of a movie about how you,
Yes.
okay, like how you sort of
You become
behave.
like your own witness to yourself.
Yeah. So
Yeah.
let me ask you, are there certain requirements for an individual to get to the point where they can do that? Like, let's just say, if someone hasn't had a lot of therapy, maybe they know like something's off. They haven't done any cognitive behavioral therapy necessarily or talk therapy, but they're like, ooh, is this like a quick fix for that? Are there other things that a person needs to like do to prepare for a session like this?
I don't actually think you have to like fail other treatments to be eligible for ketamine assisted psychotherapy. But also I'm a psychiatrist and I run a multidisciplinary wellness center. So you are within the container of psychotherapy, psychiatry, and other alternative healing modalities. So I guess that's why I created it, because I think you can do it safely as long as you have a container. And the preparation is really just as long as it takes for each individual. Some people can be like, oh, you know what? This is really, I'm feeling stuck. I've been in this job for a long time. Like, I know in my heart I could be doing that, but I can't I can't let go of this and do that. I can't figure out how to get from here to there. Psychedelic therapy amplifies and expedites regular psychotherapy.
Mm.
So it's not really that different than regular psychotherapy. It's just easier to access if you have the right situation. So in terms of prep, like clients come into home LA and we'll have them medically and psychiatrically cleared, and some people meet with the person that they're going to work with, their psychologist, one time, and they feel like, do you know what? I totally trust you. I feel like an immediate kinship. I'm feeling safe in this environment, and we can move forward. And other people have a more difficult time. You have to essentially move at the speed of trust. Some people take a little bit longer to get there.
And trust in
And also
you,
you can
trust
tweak
in
the dose.
themselves, and like, yeah, what does that look like?
Yeah, that's a good point. Trust in themselves and the
Mhm.
situation. I mean, yes, trust in us, but that I feel is almost less important than the trust in
Yeah.
themselves, because it's their own unconscious defenses that block them. So they have to be able to feel comfortable enough and safe enough to let that go. Um, there was a interesting quote: trauma in and of itself blocks the capacity for novel thought, while psychedelics open the capacity for novel thought. But it won't happen unless you're feeling safe enough to allow it to. So there's an allowing
Yeah. Well, I mean,
process.
I think that's such an important point because when you think about it from someone maybe who has not had an experience like this before, when we think about the mind, and I was sharing a little bit with you prior to our recording, but when I went in as a business owner, full fledged, like jumping in with 2 feet, I never learned more about myself than when I did that, when I committed to doing that, right? Like I had no idea that was going to be part of my journey, but part of my journey was truly this self exploration that it took me on that ended up being probably the biggest gift that I could ever give myself, but I didn't know that was going to be a thing. I think I've been I would say I'm a spiritual person. Not overly, but I mean I think I'm a spiritual person. Like I believe in a greater, power out there. But I think that
Mhm.
when we think about as a layperson, when you think about the brain and really the power of the brain, the subconscious and the conscious together, that can be so
Mhm.
scary. Like when you think about like what your dreams might conjure up or what your subconscious, when you really think about what your subconscious thoughts can do to inform your behavior, whether positive or negative, that's a pretty scary concept to trust in. To be like, let's go. Let's see what comes up.
Some of my mentors in, after the whole med school, addiction psychiatry, like regular Western education, and then working in practice for a couple of decades, have another certificate in CPTR, certificate in psychedelic therapy and research. And so there were some mentors in this that are older, they're 80, but they were doctors in the 50s when LSD therapy was commonly used, before it was prohibited from medical practice or research in the 70s. And so one of our mentors shared that things don't come up unless your psyche knows you're ready to face it.
Mm,
And so when you're experiencing an altered state, and this is a psychedelic experience and it can be really scary, the more you resist or try to run away or avoid this thing that's coming up in your intrapsychic space, the more difficult it is. So they encouraged us, if we could be lucid enough, to turn around and face it and say, like, hello, monster, I see that you're there, but like, what are you here for? What are you here to teach me? What do I need to learn from this? And then it becomes, it loses the
hmm
power, because we're no longer afraid of the unknown, because we don't really know what any of this is.
hmm And in some way, almost expecting it to come up in some form. So
Hmm.
when you bring your patients in and let's say they have kind of their first session, perhaps they come in with an intention or they come in with something that, they hope to heal from or get clarity on.
Hmm.
Is there a conversation of like, do you help prep them for this? I mean, what should they expect?
Of course, of course, of course. We have lots of
Mm-hmm.
prep sessions, because there's a different way of, it's like ontologic shift, a different way of thinking about the world. I only work with ketamine right now because it's the only thing legal. I've worked with psilocybin and MDMA with some research organizations and have read a lot of the literature about other medicines used in a variety of different cultures and countries.
Mushrooms is something, I hear a lot
Yeah,
about in my
totally.
circles. That's not something that you use, though, specifically.
Well, mushrooms aren't legal right now. I talk to people all the time about mushrooms, and and there are a lot of people that are
Uh-huh.
microdosing with mushrooms. And an important point, microdosing means you don't feel it. If you feel it, you're not
Okay.
microdosing. It's a sub threshold. It's a sub threshold dose of mushrooms that you're taking, which I'd be happy to talk about also. One of the ontologic shifts that's really interesting that happens is something called animism, which is the idea that all things have consciousness: rocks, trees, plants, pens, cups, like
Mm-hmm.
everything. So there are a number of mystical type experiences that one can have during the psychedelic experience that could be unsettling and could be hard to reorient towards when you come back,
Mm-hmm.
like seeing folks you lost
Sure.
or having a sense of who you were before your soul came into this existence. So it can be a bigger transpersonal experience. It can also, more for ketamine than the other psychedelics, just be a really nice, relaxing way to turn the monkey mind off. Some people come in and we just are like not doing and completely relaxed without internal chatter for maybe the first time ever for some people. So just to be is a really nice, relaxing, therapeutic experience as
Yeah. I
well.
mean, a lot of our audience is women, many really high achieving women, whether that's in a corporate setting or maybe an entrepreneur who's
Hmm.
beginning her own business. I think that women, what I've found by talking to so many of them is that they come with their own traumas, whether that's a big T trauma or a little T trauma, but
Yes.
there's definitely things that they're coming in with that I imagine can be, if you're not completely aware, that your subconscious is aware, but maybe your conscious isn't, but like that could be scary it could be scary perhaps if they're, going under, or how does
But
that
we
work?
can also make it super gentle. Like in a lot of the trainings, they trained us to give, a dose and then a booster. And the dose was like big, and you would go from like this state of consciousness to this other one that was far out. And I have my own set of anxieties and traumas, and that was not comfortable for my nervous system. And it also wasn't comfortable for the nervous system I saw of a lot of women more women than men. So I tend to deliver ketamine with what I think of as the appetizer and then the main course. So we start with a dose that is low enough that you'll feel it a little, like a glass or two of wine, but you still know who you are and where you are. That's actually referred to as the psycholytic dose, which is high enough to soften your conscious and unconscious defenses, yet low enough to keep you present and conversant in the room. This is actually a nice dose to use for couples therapy,
Mm.
individual therapy, because you're softer
Mm-hmm.
and more fluid but still
Mm-hmm.
present. And if you are wearing eye shades and headphones, you're going to control for two of the five senses so you can go deeper without going higher. So if you've ever done a meditation and close your eyes and have a really dreamy, far out experience, it's something that we can access without the altered state that some of us have already ecstatic dance, drumming, orgasm. Like these are states of consciousness that we can access anyway. Our meditators probably get there on their own, but starting out with something gentle, and then I ask people, they take their eye shades off, take the earphones off. How are you doing? And would you like to go deeper? And then you have a little bit of a familiarity with where you
Mm-hmm.
are, and you get to choose. So you're a part of the driver of the journey.
No, that's amazing. I could definitely see how that would make somebody feel like more at ease with the experience. Those especially those high achieving women who like to be in control, like at all times,
Yeah,
which
I'm one of them.
I
And that's
mean,
totally probably why I do it that way.
totally. And I think that, resilience, and we talked a little bit about this before, but like I wonder if, the way that high achieving women see resilience is just pushing through. It's just like just
Mm.
charging through it. Like there's no way around it, just go through it. How does this like tactic, if you think about it as like a tactic in a woman's tool belt, if she was going to engage in this, like, does this help her push through? Does this help her, or opposite, pull back and be
No,
like, see things differently?
I think it's to see things differently. As you were saying that, I was thinking like that definition of resilience is what leads us to overwhelm
Yeah.
and burnout and really self-abandonment, like disconnecting from what we know and what we need and who we are, and eventually what we really feel and what we want.
Mm-hmm.
We just become like tools of something as opposed to fully embodied. And so what this does is it would probably build resilience, but from a different perspective, which would be the zoom out and reevaluate value systems. Like this is it's not all about just this. So like, what is it about for me? Like what does make me happy? What's happiness to me? Maybe it's just feeling connected. Maybe like what are the things that I want in my life that will make me feel like my cup is
Mm-hmm.
full? And allowing us to ask ourselves these questions and think about it and know that it's really important to integrate that into what we do and who we are as models for ownership and business management.
And that however we answer those questions is okay. Like we don't have, like
Yeah,
we're not obligated to answer the question in a certain way because of our role as a mother or as a woman or as a wife. And I think this brings me to another
right.
question that, like our team was talking about when we were kind of, riffing on this topic. But I think that women, there is this weird balancing act that we have around boundaries, because boundaries,
Hmm.
all of that sounds great. And I think at first glance, they're like, give me boundaries, like help me, what's important in my life and what can I let go? But how do we protect, how can women protect their relationships and avoid isolation while also setting very healthy boundaries? I think that's something that women struggle with, and can
Yeah.
very easily lead to burnout, very easily lead to like overextending ourselves in areas that we don't need to be. Have you seen that before? And do you have any thoughts on that?
Big time. And also there was an interesting topic that was an interesting topic of conversation in regards to running a
Yeah.
business. Like you hire people you
Uh,
like, and then how close do you get?
Oh my gosh. I've seen that so much.
And
Yeah.
like how to how to like navigate that. Like this is me hanging out with you with my friend hat on, but now I have to wear my like I run the business
Yeah.
hat.
Oh, and
Did you
I work
do
with
the
my husband, so
notes?
you can imagine how complicated that is.
Yes, yes, totally. Boundaries are challenging, and the invisible one, and even just to learn that like no is a complete sentence. It's a complete having a boundary is a complete act of self-care. Like how important they are and how you don't have to explain, and creating boundaries that work for you mean you will likely upset other people.
That is, man, it's
Like
true. And
having
it's
them
so tough,
isn't
right? Yeah.
comfortable.
Yeah. Well, and I've also, one of the things that I've learned as my business grows, and this is something I'm learning now, actually, that as my business grows, there are people in my life that are supportive of that. And then there are people that don't know how to feel about it. Right. That there's that
Yeah.
natural evolution. Like as we grow, that there are some relationships that grow with us and there are some that go away. And knowing that that's a
Hmm.
thing, like knowing that that's going to happen and being okay, like it's not a reflection on me that that happened. It's just a reflection of the experience. But that in and of itself is tough, As a woman who cares about her relationships, of course we do. We all do.
It's hard. Yeah, that's a challenging one. I had that experience as well, and then the cycle of thought around like, did I do something
Right.
wrong? What did I do
Yeah.
wrong? Should I have done something new? Was it my fault? And then just like they're there for a reason. Like I read all these other self-help books about like being in flow and understanding that it all happens for a reason,
Hmm.
and um
And some things are not all about
and
us. Some things are, right? Like
exactly.
some things are about others
Yeah.
and how they show up and what's going
Hmm.
on in their own subconscious, right? Like we don't have to take that on.
Yes.
But Right. I love that this is sort of this, it's a tool in people's tool belt they can use to gain some perspective, which it
Yes.
sounds like that's kind of how it could be used.
And it's also, I think, important to share that it's not always necessarily about the actual experience. I think of psychedelic therapy as a process. So it's all the prep, like your intentions, what you're thinking about, what you're wondering about, what you might want for yourself. And then imagining setting your life up so that these things that you want for yourself are already present. Like how would you make room for that? How would you support that? How would you maintain that? Have the medicine experience, and then the process of integration is not only, making sense of the glimmers of insights that came up, but also the actionable ways that you can integrate what felt valuable into your life. And it's not all through verbal in integration. It can be dance, time in nature, body work, somatic work, but it takes as long as it takes. It can take 6 weeks, 6 months, 6 years. Sometimes people have a huge journey and they're integrating for the rest of their life. It's a process.
Yeah. Yes. It's like being pregnant. It takes as long as it takes. When
Mhm.
I'm 3 months pregnant, nobody's like, deliver this baby right now. You just got to give things the time that they need, right?
Yeah.
So I'm curious, Eva, for a woman entrepreneur or high achieving leader, maybe she's listening and she knows she needs to prioritize her mental health. But just like all of us, she's got, a couple of kids at home. She's got a husband who relies on her, who's also working full time. They've got financial needs, kids have to go to college, but at the same time, they've got emotional needs, and she's overwhelmed. So she knows she needs to prioritize her mental health, but doesn't know where to start. What would be your first recommendations for her on where to start?
What's like, I guess, like, write down the 7 things that people recommended, because it's probably not the first time they've thought about this or had these conversations or considered it. Like, of the handful of things that you thought about doing, what's the easiest to start? Is it just taking a walk at the beach 3 days a week?
Mm-hmm.
Is it listening to Insight Timer and meditating for 5 minutes in the morning or for 5 minutes in the evening? Is it going to the gym, going to yoga, starting therapy? Like, I would start with whatever's easier and then not judge yourself for not doing it as often as you think
Oh
you
my
should be doing.
gosh, that is
It's
so
just a
true.
matter of starting something.
Insight Timer, you mentioned, great app. They have a free version. So if you're listening, we've talked about it on this podcast before. If you don't have it, get it. It's great. But they do have like a reminder function in there. So you can remind yourself. And sometimes I get down on myself for not doing it every day at 8:15 when it reminds me that I'm supposed to. So I think your point about also giving yourself some grace. Okay, you did it a couple times this week. Like, good. You didn't do it every day, but like,
Yeah.
that's not a failure. It's fantastic.
Yeah, like, just celebrate the
Yeah,
successes and kind of not attend to what you didn't do. Because if this is about self-care, it should just be something that's going to help you feel better. And if, like, you're not doing it at all now, but you want to do it daily and you did it once a month, that's a success.
absolutely. 1,000%. Celebrate the successes for sure. When you think about the work that you do, um, in kind of this conversation around like mental health and entrepreneurship, like how do you see that evolving? Have you seen it evolving, I suppose? Like, do you see a lot of clients coming to you that maybe have their own business and they want to unlock kind of new ways of thinking or unblock some limiting beliefs? Do you see that? And also, do you see this as a way into entrepreneurial business success? Is there a correlation there?
Yeah, it is kind of nice to see a lot of new entrepreneurial creative modalities developing from people that are sort of really motivated by herbalism or gardening or coaching, supporting actors, creative modalities, like creating something that fuels you, as long as it's generative and you can put your time and energy into it. And it's also, and there is always the value of like your time is valuable. So not being shy, not being too shy for asking for payment for what you're doing.
Oh my gosh.
Because a
Or
lot of times you
charging what you're
start and then
worth.
you just want to do it for your friends and family. Yeah. Like there's a whole thing
Oh,
there
yeah.
that's developing in, in the early days of starting something new and having being something that's like a little bit, if it's in the healthcare field, that's a little different, because there's a lot of new, different modalities of like Reiki, and people are doing like tuning fork, Reiki, cranial sacral, like things I haven't heard of before, but people find it helpful for their sort of like their energetic
Mm-hmm.
mechanics, the body, mind, spirit, like the whole thing. And exploring this in small groups is also really nice. Like I've seen a lot of groups gathering on WhatsApp that are like young women developing businesses, or just not even businesses. I guess it is businesses, like developing a path for earning income, engaging in something that is self-care oriented, that fuels them, and they can also offer this service outside of
Yeah.
themselves.
I mean, it's really amazing. It's fascinating. I'm hearing about it so much, like in the circles that I travel in, which are largely entrepreneurial business. It's just fascinating and wonderful that it isn't just talk therapy anymore, but there's so many other modalities that we can engage in that can have a similar result and
Hmm.
sometimes faster. But like even the combination of multiple things at once just gives us so many more tools in our tool belt, I think, as women that can feel, and some of them can feel, maybe some of us have guilt when we step away from the family and try to support ourselves. But you know what? You can find something that can support you and your own mental health. And it in turn can launch your business to another level. It can support your family in a bigger way and your children and their own mental health journey. I mean, it's so powerful.
And it's always in service, anything we do in service of making us happier, healthier, better humans on the planet is going to ripple out and be of benefit to the people in our orbit.
Absolutely. I mean, think of it like and even since I've engaged in some of these activities myself very recently, my children have noticed, my husband has noticed. It's a topic now that's more openly discussed in our family because of my experiences. It just kind of seems like it opens up the
Hmm.
topic now that it doesn't have to be like a forbidden topic. That in of itself is
Hmm.
growth, right? Like for people, and gives them an avenue to be able to explore their own mental health.
And being open to creatively exploring, what does healing mean for you?
Yeah, exactly.
Because
Amazing.
I imagine it's as different for all of us as we are from each other.
Yeah. This is just great. I mean, I'd love to, Eva, I'd love to have you share a little bit about how your audience can learn more about Home LA. You're based in Santa Monica, California, correct? Yes.
Yes.
So, how
Yes. Yes.
can people learn more about Home LA and your integrative approach to mental health? Do they need to be in person? Can they be online? How can they best be served?
Yeah. We are available virtually and in person. We're a multidisciplinary team offering psychiatry. And by integrative, it's not, we are Western trained physicians, but bridging the Eastern, Western supplement, really holistic integrative approach. We also offer psychedelic service, psychotherapy, EMDR, somatic experiencing, meditation, ketamine assisted psychotherapy, as well as body work, some treatments through massage therapy, as well as energy healing. And our website is home-la.com. Our email is info@home-la.com. And you can always call or text us at 24-877-1333. And there's a fun thing I offer for individuals involved in any healing practices. We offer small group ketamine healing
Mm.
experiences for people involved in the healing arts. So if they're curious about the potential, but would like to explore this in a small group, it's like geared towards those in the healing
Oh,
profession.
interesting. That's so fascinating. I love that. And we will include all of that contact information in our show notes as well, so that if you're listening and you want this information or you missed it, go to the show notes and you'll be able to grab it. I want to just end with this question. If you could leave our listeners with like one key insight, right? About the relationship between inner wellness and that professional
Hmm.
success, assuming you're talking to, a woman entrepreneur or a high achiever who wants to achieve that professional
Hmm.
success, but they've got this, you know, they're reconciling kind of what's going on
Yeah.
inside. What would you say?
Don't do it alone.
Mm, yeah. So good.
Like even if you're a solo, you're the only one running your business, do this in conversation with your friends, with your family, with your mentors, your kids. Like we can always learn from others. I read this book called Outrageous Openness by Tasha Silver that I kind of listen to on repeat when I get caught up in trying to control the outcome and wanting things to be a certain way, because it is a constant reminder to allow and surrender and know that whatever I'm doing, if I'm doing it like from a heart centered, positive intention driven way, I'm not alone in my energy and doing that. Like, and I can bring in sort of my
Yeah.
ancestors and other energies and feel more grounded
Hmm.
in what I get to release and not hold it, and be connected with energies that will help me be involved in this.
Amazing. I love that. That's such a great way to end that. Be in community with one another. Dr. Eva Altobelli, thank you so much from home LA in Santa Monica, California. Thank you so much for joining us. This was fantastic, and I really appreciate your time and your expertise to share with our audience today. Thank you.
Oh, I'd loved talking to you. This was great for me. Thank you
Super
so
fun. And
much. And hi to
I'm
everybody
gonna
out
stop
there.
us. Hang on 1 second so we can chat after. But thank you, and thank you everybody for listening. Oh, we'll see you next week. I hope this conversation with Dr. Altobelli opened your mind to new ways of understanding healing and self-awareness. If something in today's episode resonated with you, take a moment to reflect. Where in your life might you be ready to see things from a new perspective? If this episode spoke to you and you want more clarity in your business to see what's working, what's not, and where to focus next, my business audit is a great place to start. It's a personalized review of your business that helps you simplify, realign, and make your next moves with confidence. You can learn more and book yours at AndreaDeLacerda.com. Just navigate to work with me. Thanks so much for joining me.